What do you find yourself inclined to do kind of in a very natural way? Are you able to build that so that it's more of a natural step rather than a forced step? So if it's walking after dinner, great. But if it's not, maybe it's a little bit of downtime before you go to bed, or it's a little bit of time in the morning before you have to talk to everybody where you decide this is going to be a phone-free 15 minutes for me. I'm going to journal or meditate or just sit there and have a cup of tea.
Hello and welcome to the How Are You Really podcast. Today's episode, we talk about when the body speaks, the mind-body connection. I am your host, Dr. Faryal Mallick. I'm a child, adolescent, and adult forensic psychiatrist, and I'd like to welcome our guest speaker, Dr. Noha Abdel Gawad. And Dr. Gawad is a board-certified psychiatrist specializing in general adult and consultation liaison psychiatry. She is a fellow of the Royal College of Physicians and Surgeons of Canada and an assistant professor at the University of Toronto. Dr. Abdel Gawad has global experience, having trained and practiced in various regions. She earned her medical degree from Cairo University, completed a research fellowship at Mayo Clinic, and finished her residency at the University of Texas Health Sciences Center in Houston, followed by a fellowship at George Washington University. As a clinician educator, she is involved in training medical students and developing CPD initiatives for primary care settings. In her practice, she provides comprehensive psychiatric care, emphasizing lifestyle modifications alongside medication and psychotherapy. Dr. Abdel Gawad is developing educational tools in English and Arabic to address common mental health concerns. These are available on our website, mindsmatterpsychiatry.com. Welcome, Dr. Abdel Gawad.
Thank you. Thank you so much for the introduction and for having me here today. I can't tell you how excited I am to be talking about this topic, which is actually quite dear to my heart.
Yeah, same here. It is very dear to my heart. So I'm very excited to talk about it. Thank you for taking the time to talk about it. So I'm going to jump right into it. So what is the mind-body connection? What does it mean?
I think that's a really good question. I think to really simplify it, it is that communication that happens between what goes on in our minds and what goes on in our bodies, and that recognition that they are not two separate entities, that they are actually one entity in consistent communication, right? That if you're not feeling well in your body, it can translate into some maybe patterns in your thinking and feeling, and vice versa. If you're not feeling well in your mind, it can translate into some physical symptoms. So just at its core, it's that, that constant communication between what's going on up in your mind and what's going on in the rest of your body, and then that recognition that it's one thing.
Yeah. So let's divide those up. So can you describe what depression, stress, or other issues of the mind, how do they affect the body? Like, what do you see?
There's a whole set of different ways we could answer this, actually. We can talk from a very biological perspective that when we are stressed, our cortisol levels rise, right? That begins with our hypothalamus, which is in our brain, and then the signals are sent all the way down to our adrenals, which is in our abdomen, to release the cortisol. So again, brain and body, right? And then that cortisol has a whole host of actions on our different bodily functions, right? In the immediate stress situation or an acute stress situation, it can be really useful, right? If you're needing a surge of blood sugar, for example, to get through a particularly demanding scenario or stressor, then cortisol does that for you. But then if you're in stress for a very long time, you're at risk of diabetes, for example. So one way to think about it would be that very biological aspect, right? That what is going on in our neurotransmitters and our hormone systems that is a result of the stress and affects the body. In a more more practical terms, right? What are we feeling, right? It could be anything. It can be muscle tension, for example, when we're stressed. It could be stomach upset. It could be palpitations, chest tightness. My favorite example is stage fright. Right? What happens when someone goes on stage or they have to give a talk or do a podcast, for example, and they're perfectly healthy, but all of a sudden, their voice is funny, they've got blurred vision, they've got some chest tightness, maybe they need to run to the bathroom, right? So all of these are physical effects in the body that are the result of a mental state of maybe anxiety or fear.
So looking at the other way around, if the body is not functioning well, or if there's a physical illness, how does that affect our mind?
It is a vice versa relationship, right? It goes both ways. If you're unwell, if you're in pain all the time, for example, if you're not able to function normally and carry on a normal quality of life or your regular quality of life, right? And then that affects your ability to engage in your pleasurable activities, for example, to go out, to go have a walk, to socialize with friends and family. And then that can result in lower mood, increased anxiety, and you kind of end up with this cycle or self-perpetuating cycle of negative psychological symptoms that then might make the physical symptoms feel worse, that then make the psychological symptoms feel worse, and people kind of get stuck in this cycle that we have to learn to break a little bit.
Yeah. So how do you break these? Like, what are the mind-body activities?
Um, there's a whole host of things that can count as mind-body activity. I think I tell people it's whatever allows you to kind of access that Zen flow state where you're quietly focusing on this physical activity that you are doing with your body. Like journaling is an example, right? You're using your hands to write, but you're also using your mind to allow those thoughts to come on paper, right? And as you're doing that, it's very hard to actively journal and still be distracted by a million different things. So you're able to focus and kind of be in the here and now. Journaling is only one example. Things like woodworking are a great example. Gardening, yoga, like anything that allows you to use your body. And in that process also calm your mind and kind of have that mind-body state of relaxation.
Yeah. Okay. So how did you get interested in this area? What led you to become an expert?
I think a series of fortunate events, right? So, right out of med school, you're trying to figure out what you want to do. And then in my case, I was interested in psychiatry. And as I went through psychiatry, you're trying to figure out, am I an inpatient psychiatrist? Am I a forensic psychiatrist? And I ended up being really interested in consultation liaison psychiatry, which is exactly that intersection of mind and body, where you get to work with people who are coping with a whole host of physical illnesses or conditions that are affecting their mental health, and also vice versa, that may have some mental health conditions that make them feel like they're having physical symptoms, right? And I found that really interesting. And I found it really applicable as well, that it wasn't a set of skills that were maybe just like defined to clinic, that they were a set of skills that you could really apply to day-to-day life, and that more people should know about what is going on in that relationship between their mind and body.
Yeah. So most people are not attuned with their bodies. They there's a disconnect there. So how can people recognize what is going on in their body if they're stressed out or, something is off, right? They can maybe tell something's off, but they are not attuned with their body. How can they go about doing that?
I would say that's a practice. That's something you actively focus on. And it's a practice of observation, like observing where different body parts respond, or where you get certain physical sensations when you're stressed, for example, or when you're relaxed, right? It's a practice of observation, and it has to be non-judgmental, right? It can't be, I'm really stressed, I'm having chest tightness, how dare I have chest tightness? Right? Or how dare I feel stressed, or how am I not, more invincible, essentially, right? So it has to be like a very consistent practice of observing what is going on in the mind and the body at the same time, and then really building those patterns to get to know yourself a little bit better, and definitely not being judgy about it with yourself.
Okay, so and then specific techniques. How can people use their mind to calm their body?
I think there's a variety of different things people can do that are very easily inaccessible. The most common one we talk to patients about is deep breathing. Like, can you do some deep breathing or box breathing exercises, right? Where you count, inhale, count to 4, hold that, count to 4, exhale, count to 4, hold that, and count to 4. So that's box breathing, which is one way that you could use your mind and your body essentially to calm each other. Other activities would be like progressive muscle relaxation, which I actually quite like, which involves scanning your body from bottom up, so from your toes to your calves to your thighs and all the way up to your head and neck, and just gradually contracting and relaxing those muscles, maybe 5 seconds each, 3 seconds each, whatever you're feeling up to. But it's a way to use your body to calm your mind, and as your mind starts to feel calmer, then your body will relax more, and then your mind is also calming your body back.
So it's like a feedback loop. So we're in the practice of like the mind, right? Psychiatry. I'm sure that in ancient times, this was a very common thing where the body was being used and rituals were being done and all of that. But now it's all about either medication or you're sitting down and doing therapy. So what role does body actually play in, matters of the mind?
I think it's essential. I think it's really interesting that you bring up kind of this maybe ancient wisdom or inherited wisdom. Like I grew up hearing my grandmother always say, something to the effect of healthy mind lives in a healthy body, and that you can't have one without the other. And then, things as simple as going for a walk after lunch every day or after dinner every day was something that was very important and consistent for her. And kind of having that mindset or having that inherited wisdom, I think, helps a little bit with awareness. But you're right, we live in a very distracted world right now. We're at our computer screens all the time, we're at our phone screens all the time, right? There's almost like no time to do these other things, or if you do, it becomes another chore. It's like, shoot, I have to go to the gym, check mark, right? And so even that becomes stressful. And I think what I would like for people to maybe reconceptualize or start to think about differently as these activities, these physical activities, as kind of being important and essential and a normal part of day to day, not something that has to be forced in, or something that is kind of in that list of accomplishments we have to get through to satisfy a certain goal, for example, or a certain mindset. That it's more of like a normal, healthy way of doing life, that we incorporate physical activities, whatever they may be. If it's a short walk, if it's a yoga class, if it's whatever it is for you.
Yeah. Okay, so you brought up distractions. So modern life has kind of like just made us not maintain a healthy mind-body connection, right? So daily practices, I know you said like taking a walk, but it still becomes a checklist. So how can people incorporate it where it doesn't feel like it's a checklist?
I think keeping it simple is my answer. Like maybe observing for what naturally fits into your day. What do you find yourself inclined to do kind of in a very natural way? And then, are you able to build that so that it's more of a natural step rather than a forced step? Right. So if it's walking after dinner for you, great. But if it's not, then, maybe it's a little bit of downtime before you go to bed, or maybe it's a little bit of time in the morning before you have to talk to everybody, where you decide this is going to be a phone-free 15 minutes for me, where I'm going to maybe journal or meditate or just kind of sit there and have a cup of tea. Right. So I think it's just keeping it simple. It doesn't have to be complicated or in any way onerous. It just has to be something you enjoy doing, that you're able to do every day, or on a regular basis, let's say, in a way that doesn't feel forced or exhausting.
Yeah. You brought up like woodwork, right? So it's almost sounds like hobbies would be something like a body activity. So can you elaborate a little bit more about that? What other things people can do, or they may actually be doing, but they're not like really aware of it, or they're not mindful of it, that is something that is a mind-body connection?
Yes, and there's probably dozens of examples I could come up with. Woodworking is one of them. Gardening is another. It's my personal favorite, to be fair. I get that little bit of that physical activity, but also that kind of quiet mind experience that comes with it. Crocheting is a very common one I hear from my patients. Saying musical hobbies or musical instruments or activities. Really anything that allows you to be in the here and now, to enjoy that kind of that quiet mind state, or that focused mind state as you're involved in some sort of physical activity. And if you tell me boxing is your mind body activity, I'm okay with that. It may not be the most obvious answer, but hey, if this is what works for you in terms of I'm doing something with my body that is calming my mind down, that works. So really, really, a lot of these hobbies, whether they're creative hobbies or physical activities, they would qualify.
So you talked about the here and now. Can you get into that a little bit? I don't want to make this about mindfulness, but being mindful, being in the here and now, what does that mean?
It really means kind of just that we're not thinking about all the worries that are about our future, like all of our future worries, and we're not bogged down by all of our past anxieties or mishaps or whatever. That we are in this moment and enjoying and accepting what that moment is bringing to us. And then one of the exercises that I quite like is practicing blocking out 12 hours before and 12 hours after. Everything beyond that 12 hours plus minus time frame kind of doesn't exist in this moment. We're not going to think about it all. We're just kind of in the last 12 hours and in the upcoming 12 hours, and just kind of practice doing that, and maybe scan your body and see how you feel. Most people find it quite relaxing. There's a few that I've heard say it's anxiety provoking. But for the most part, people find it quite relaxing to think, you know what, I don't have to be burdened by all of this stuff from way before and way after, right? I'm just going to be here focusing on what I have to do now. And then, when the next step happens, I'll focus on that.
So, I feel like as you were talking, panic attacks were coming to my mind, right? What if like somebody had a panic attack within the last 12 hours, right? So now that's something that happened in the 12 hours. How would you tell them to cope with that?
Um, I would say, again, that non-judging observation, accepting that it has happened, accepting that it might happen again, and then kind of figuring out, well, what is going on in my life that is increasing my anxiety levels? What can I do about it? Maybe practicing some of those strategies that could help mitigate a panic attack so that they become a little bit more automatic. So again, those box breathing exercises, the muscle relaxation exercises. I would add grounding techniques like the 5 things you're seeing, 4 things you're hearing, 3 things you're smelling, right? And 1 you're tasting. So if you're practicing those in your kind of non-panic time, then when a panic attack happens, then you've got those tools in your toolbox to be able to apply. And it also makes you feel like you're able to do something about it, right? That you're able to calm your own mind and you're able to calm your own body down with these skills. So that would be my thought, that if somebody was kind of in that 12-hour time frame, having experienced something negative, this might be a good chance to just kind of really think through it, accept it, let it pass, and maybe plan for, well, what next? When it does happen again, what can I do about it? And that sense of, let's say, empowerment or problem solving that can come with that is actually really important.
Yeah. So can you think of somebody that had this experience where they were kind of disconnected from their mind and body? And what was that like for them? Possibly like an imaginary patient. Do you have like a story of how that mind and body connection, you teaching them that helped?
So the thing that comes to mind for me are patients with trauma or PTSD as we're talking about this. People who have had traumatic experiences, especially multiple traumatic experiences, eventually get stuck in that fight-flight mode, right? They're always on guard, they're always edgy, they're possibly feeling a little bit disconnected from their own bodies or from their surroundings or from other people around them. And one of the strategies that can be really helpful is actually mind-body activities. Medications and psychotherapy aside, one other thing that people can do is kind of these activities that can help them feel safe in their body again and safe in their own space again. And that's what mind-body activities do. So if somebody has PTSD, for example, I will recommend, hey, do you like yoga, for example? If not yoga, well, what else can you do that can be like a mindfulness activity? If they had a hobby, for example, like we talked about, music or painting or woodworking, then I'm really encouraging them to engage in that in a very regular and proactive way. And I kind of write it down for them in their notes and have them write it down. Like, this is your prescription. This is this goes in addition to the medications, that you're going to do this once or twice a week, because we know that these activities reduce our overall kind of stress levels and increase that feeling of calm and that feeling of safety again, which we really need for healing from trauma.
Yeah. So what role do you think self-awareness plays in that healing part and the mind-body connection?
I think it's essential. I think it's really important because it helps you make sense of your experience, right? So if you weren't aware where all of the responses were coming from, if you weren't aware that maybe the irritability was rooted in trauma, or that the panic attacks were rooted in, work stress, for example, or a relationship problem, then you wouldn't know how to deal with it. You don't know where the problem to fix is. As we increase kind of that awareness of, well, what is going on for me, what is going on in my mind and in my body, and where do I think this symptom is coming from, then we're able to get to the root of the problem and eventually kind of try to work through it or solve it if possible.
Yeah. So what do you think are the most common barriers or issues that you see that prevent people from fully understanding their mind-body connection?
I would say that we're not trained in this. We're not taught in school or at home or at university even that this is something to keep an eye out for. So if you are someone who was lucky to be maybe a little bit more naturally self-aware, had been able to do some reading, or your mom or grandma taught you something, well and good. But if you were not, then it might be 3-4 decades into life before you figure it out, or kind of clash with it, so that you have to figure it out. I'd say the biggest barrier is that we're just really not taught to take care of ourselves in that way. as we're growing up, or as we're going through our educational systems, right? We're taught all sorts of things. We're taught to accomplish, to build nice CVs, to build hobbies, right? Maybe, but we're not really taught to, hey, just kind of sit there and think through, how are you feeling? How's your body doing? Where is this coming from? I think that would probably be the biggest barrier.
Yeah, that's very true. So, I kind of want to open it up, letting you just kind of talk about, the stuff that you're building on your website, general information that would be helpful.
What's really important to me is, and I spend a lot of time on this kind of in my own appointments with patients, is that education aspect, right? I can tell you to go do A, B, and C and say this is your prescription, but if I don't explain why or where this is coming from, or even some of the science behind it, I don't know that it's going to be effective, which is part of the reason that I decided to make those flyers or handouts, right? Because I was having these conversations over and over with people, with adult patients, right? About, healthy sleep. Why is that important? Well, trauma, how do we manage that? What's the difference between a panic attack and an actual heart attack? And then I'm having these conversations on an almost daily basis that I felt like there's maybe some room to make this information a little bit more accessible. It was kind of on the other side of that, it was also a creative activity for me to be able to, I don't know, focus a little bit on, in possibly mind body activity, even though it was using a computer, and just kind of create something that was visually appealing, that was simplified. It was a creative activity for me as well, I have to say. But at its core, the idea was, hey, like, this information needs to be disseminated a little bit more than one patient at a time every so many minutes per day. So hopefully there will be opportunities to build on that, and to just maybe expand a little bit that awareness for people.
Yeah, I'm interested a little bit in the science. So, for instance, I would come to you and I have no idea about, okay, you're telling me go paint, and I'm just like, but why? Why are you telling me this? How is it going to help me? I'm anxious. Help, give me a medicine. So.
I'm going to give you a medicine, but it's going to take 4 to 6 weeks to kick in, right? So until then, we got to empower you with something different. I think painting is an example, right? So only if you're going to enjoy it or be able to benefit from it. But really, the idea is, again, we take it back to those cortisol levels, right? When we're in stress, acute or chronic, and our cortisol levels are high, what are things we can do to bring it down, right? What are things we can do to kind of normalize those levels again? And anything that's a relaxing activity that allows you to just kind of breathe, and to calm your nervous system down, right? If we think about kind of sympathetic nervous system, which is our fight-flight response, and parasympathetic nervous system, which is our rest and digest, right? How do we move from fight-flight to rest and digest? Right? And those activities really help us do that, right? Anything that allows you to calm down and kind of breathe easily and sleep well, is going to promote kind of that transition to rest and digest, right? Fight flight has its purposes, like in moments of stress, for example, or in, if you really needed to get something done and you have a deadline, but you can't live in fight flight. And so those activities can help with that transition.
So what if somebody comes to you and says, and this has happened to me before, I don't have any hobbies, I don't have any interests. So what do you say? Like, how can they explore different things, and how do you convince them to explore things?
Such an interesting question. And it happens quite frequently. And I have to say it's challenging. And it is more challenging as people are older. Right? If somebody is retiring, they're in their late 60s or mid 60s, and they've worked a lot their whole life, or they've taken care of their family, and now they're an empty nester. And so they're in this phase of life where they're not working. They also don't have a family to take care of. And they're like, but I've built no hobbies or so life or friends. What do you do with that? It can be really challenging. I still encourage them. If you go on the internet and you type in on Google 100 pleasurable activities, you get this PDF. You get this list of 100 activities, and I make a point of saying, pick 3 of those and let's try them out, and let's do it with curiosity. Really introduce that play element into it, right? Let's be curious. Will you like painting? Will you like a salsa class? Will you like journaling? And we can rate them on a 0 to 10 scale. 10 being the highest enjoyment you experience, and 0, you did not enjoy this at all. And let's try to come up with a few that you might be able to work into your day-to-day life. This is easier said than done, but this is kind of the strategy, and you just have to be really patient with it. You have to be patient with your patients, but they also have to be patient with themselves, that it's not going to happen overnight. But that's typically how I approach that.
That's really a good way to explain it because that happens so frequently, and it is really hard to convince people to, find something or just try it out. It's just like, no, I don't. And teenagers do this too a lot, right?
Yeah.
Or younger adults, right? They're in college and they're like, no, nothing. Absolutely nothing is gonna help or anything. And then, there's again, mind body connection. I see a young adult who used to run track, but they've injured their knees and ankles. And then that was the only thing that was interesting to them. Now there's nothing. And it's a struggle getting them to even try things,
Mhm,
right?
mhm.
I think that older people might be a little bit more open to doing it, but teenagers and younger, just college age, transitional age adults, it's just, I feel like that's a challenge for me. Do you have any advice for me how I can help them?
I actually work with older populations a lot more, but as
Yeah.
you're saying that, I'm thinking that maybe the issue is that cognition. Maybe the challenge is that word they tell, that statement they tell themselves, like, this is the
Yeah.
only thing I'm ever going to enjoy, right? And that would be probably the work of some CBT, right? Well, are there other things you can enjoy? Is this really a realistic statement to make, right? To commit to this one activity for the rest of your life and as the only thing that where you will derive pleasure from. Sometimes I talk to people about the reward circuits. In very simplified terms, I say it's like a little electrical circuit at the base of your brain, and we all need that for that reward to be stimulated in healthy amounts, right? When we're depressed, we don't get enough reward, and when we're manic, we get too much reward. So it's a healthy amount of reward, and if you're not feeding that circuit with healthy activities, then it's going to be harder to experience reward. And then sometimes I use that for people who enjoy hearing a little bit of the science behind it
Yeah.
to see, well, what can we do to kickstart your reward system differently? Like, I understand it was the running for all these years, but I wonder if, playing the guitar could do the same thing.
Yeah. Yeah. All right, so I have like one more question that like I feel like would kind of pertain to mind body, but not in an obvious way. Some people you just absolutely have to prescribe a medication, right? So now
Mhm.
you've prescribed something and they've looked up the side effects. Now their body is experiencing absolutely those side effects. Can you kind of help explain what that mind body connection is there and how people can cope with that? Because you're not going to have side effects from every single medication or all
Fair,
the side effects from like every medicine.
fair enough. So it's that anxiety about trying an anxiety
Hmm.
medication, essentially,
Hmm.
right? If you're an
Hmm.
anxious person, everything is going to be anxiety provoking, including the treatment. I spend a lot of time before the prescription talking about it.
Hmm.
And educating about the potential for side effects, and try to find some numbers like your number needed to treat or number needed to harm, for example,
Hmm.
that I share with patients. You assure them that most of these side effects are reversible if we stop the medication, and that if it makes you feel like a zombie, then it's a side effect. I'm not. My job is not to make you feel like a zombie. I'm going to stop the medication and try a different one. I also, for my very anxious patients, will start with we call pediatric doses. Be like, here, let's just try it, test dose. Let's see how you do. Let's see how your body responds to it. And then ideally in those doses, nobody's experiencing side effects, right? If
Hmm.
they're in these subtherapeutic doses. And so once they're able to build that information of, hey, I took this pill and I'm okay. Like I
Hmm.
didn't have any terrible side effects from it, then they build that confidence to be able to increase the dose. And it might take a little bit longer than you would typically want, but you're also working with a person's kind of personality just as much as you're working with their biology and their psychology, right? And so you just kind of work with that and try to meet people where they're at. And every now and then I'll get the occasional person for whom every medication will give them all of the side effects or a lot of anxiety symptoms really that they perceive to be side effects of the medications. And then you ask them, well, what are you comfortable with? Do you want to get off of it then? And then really work with the psychotherapy and the different lifestyle modifications and see, right?
Hmm.
Ultimately, my goal is for people to feel better and with whatever strategy allows them to feel better.
Hmm.
But if they don't, then they might come back and say, hey, can we try again? And then you probably have a better chance the second time that way.
That's great advice. Okay. So I always like to ask, how are you really doing?
It depends on the day. So I've had a nice long weekend. It's sunny out. I've had a good night of sleep for the last 3 nights, so I'm doing well. A couple of weeks ago, I was on call. I would say I was not doing well. It was a very heavy call shift, and I can tell you that by the end of it, I had a lot of different muscle pains and chest tightness and like really extreme fatigue, which I would really attribute to the stress of having been on call and having had to manage all these different events that came up. I would say it depends on what's going on, and just kind of you recognize that, and you manage or adjust accordingly, really.
Yeah. When you are on call and it gets that busy and stressful, what are you doing? Are you using any of the mind body activities during the call? I know it gets really busy, but for let's just say other physicians or people that are really high functioning, very busy professionals, how can they incorporate just some mind body activity to help cope with that stress on a daily basis or when that call period is going on?
Fair. One of the things I do is I just take the longer way to work, so I walk to work. So rather than take the 5-minute shortcut, I'll take the longer way, just give myself a little bit more walking time, a little bit more outdoor time, back and forth. And so I'll do that. Lunchtime is sacred, unless there's an emergency, but you are going to take an hour off or 45 minutes off to hydrate and eat and just kind of have some quiet time once a day, every day, right? Whether you're on call or on service or whatever your responsibilities are, you have to build that in. It's not going to happen for you. And I really encourage learners to do the same, right? Like I'm always like, did you have lunch already? Do you need to step out and get some fresh air? Because we've been in here for 12 hours and we haven't seen the sun. So I do try to model that. It was modeled for me. I have to say it was modeled for me. And so I try to model it for learners now. But I think it's just important to do those very basic self-care activities, right? If you can fit in a walk, if you keep hydrated, take some time, like a little bit of quiet time where you can have a healthy meal and just kind of decompress from the morning so you could go on to the afternoon or go on to the evening. And I think that probably covers it for the call weekend or the call shifts. And then, afterwards, you want to make sure you do something really nice for yourself.
Yeah, right. Absolutely. So I'm curious, how did your attendings or superiors model it for you? What were they doing?
One of the first attendings that I worked with and who kind of continues to be a mentor for me, when I joined his service, he had just had a baby. His wife had just had a baby. And he said, my wife just had a baby, so we're going to get out of here at 4:30 every day because I have things. I have a life to get to, right? I have to be home. And it was literally my very first month on inpatient psychiatry, and I've carried that with me, right? You know what? We have a life outside of the hospital and outside of work, and 4:30 or 5 or whatever the cutoff is, this ends and that life begins. It's okay. There's no guilt around it. There's no, right? There's no shame in it either, that you have these other responsibilities and things to get to in your real life, and that's okay. So I really appreciated that, and I've really been able to just kind of take that and carry it forward.
That's awesome. Okay. So lastly, what does the phrase, how are you really, what does it mean to you in the context of the mind-body connection?
Let me see. I would say it is really that process of just checking in with yourself, and knowing where you stand in a given moment or in a given phase of life. And managing your activities and your expectations of yourself accordingly. So if this is kind of a tough time in life, if it's a time of grief, if it's a time of you just had a baby, if whatever it is, this is a time to maybe take it easy and sit back and recognize that you may not be kind of 100% and therefore not expect 100% of yourself, right? Time to be really compassionate, I would say. And there are other times where you're doing well and you're going to feel energized, and maybe this is the time to do a little bit more and commit a little bit more to a few things or add in a new activity or hobby. And so it really is about kind of just taking note of where you're at and meeting yourself where it's at, versus, I would say, adding the expectations without being mindful of where you are or how you're doing.
That's an amazing way of explaining it. So, any key advice, any parting words that you would have for me, for the audience?
I mean, if anything, I would say thank you for creating space for this topic and for asking these kind of very, very thoughtful questions about it. My only advice would be for people to really just kind of be respectful and non-judgmental of how they're doing in their day-to-day or in their various life phases, and to ask for help if it's needed. right? If you're not doing well, there is no shame in reaching out for help, or and it can be, you're asking a friend or family, and it could be you're asking a professional. But that reaching out and not being isolated in your experience, I think, is really important, because and I guess we didn't really touch on this, but those social connections, or those the quality of those social relationships, is another one of those things that is very calming to both mind and body, right? And so to be able to leverage that, I think, is really important.
Yeah. Well, thank you so much for your time, for coming on my podcast and speaking about this topic. It's very dear to my heart and it's core to my own practice. So I really appreciate you coming and talking about things. I've learned something, and I hope people did too.
Before we close, I always ask, how are you really doing? Thank you so much for spending this time with us on How Are You Really? If something in this episode spoke to you, send it to a friend, leave a review, or follow the show. It really helps. Until next time.